Our Children's Hospital's Solutions for Patient Safety Network has prevented hundreds of children from having catheter-associated urinary tract infections. We have compelling evidence that shows if we reliably implement our SPS prevention bundles, we will prevent harm to our patients, and we are committed to doing just that. The CAUTI SPS Prevention Bundle is a two-part bundle intended to prevent catheter-associated urinary tract infections. The CAUTI Maintenance Bundle component of the CAUTI SPS Prevention Bundle includes 5 standard elements as well as 1 recommended element. In this video, we will walk through the steps for completing the standard elements of the Maintenance Bundle. For any of the procedures in this video, you should prepare a separate work surface and clean the surface with approved sanitizer prior to setting up for the procedure. Discuss the need for the indwelling urinary catheter daily during rounds. Using catheters only when clinically necessary will reduce the population at risk for CAUTI. Review the necessity for removing the catheter daily and make sure to also document indication daily. Prepare the patient for the procedure. Make sure the catheter is secured to the patient's upper thigh. Allow enough slack so that there is no tension on the catheter with leg movement. Use of a securement device is preferred. Clean your hands with soap and water or use alcohol-based hand sanitizer. Prepare supplies on a clean work surface. Next, put on non-sterile gloves. Cleanse the perineum per your hospital's practice guidelines. Remove non-sterile gloves after perineum and catheter care and clean your hands. Make sure to maintain a closed drainage system. If there are breaks in the aseptic technique or disconnection or leakage, replace the catheter and urine drainage equipment using aseptic technique and sterile equipment. Obtain urine samples from the urine sampling port using the aseptic technique. To obtain the samples, first clean your hands. Next, set up the sterile field with supplies using the sterile technique. Then, scrub the sampling port with alcohol for 15 seconds and let dry for 15 seconds. Twist the sterile syringe onto the sampling port without contaminating the tip of the syringe. Then, withdraw the desired amount of urine. Untwist the syringe from the port. Then, transfer the urine sample into the sterile specimen container. Keep the urine collection bag below the level of the bladder. Keep the bag and tubing off the floor. Do not put the urine collection bag in the bed or on the patient's lap during transport. Routinely empty the urine collection bag at a frequency indicated by your hospital's policy, when it is 1/2 to 3/4 full, and before transport or ambulation. Finally, keep the catheter and urine collection tubing free of dependent loops and kinks. You can now successfully complete the Maintenance Bundle component of the CAUTI SPS Prevention Bundle. If you reliably implement these best practices, children at your hospital will be saved from harm. Start today. Adopt these best practices and save children from harm, one child at a time.